Good morning. My name is Adam, and I'll be your conference operator today. At this time, I'd like to welcome everybody to today's conference call. It's all about listening, getting your community's ideas on health in America and nursing. And all lines have been placed on mute to prevent any background noise. And after the speaker's remarks, there will be a question and answer session. If you'd like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. And if you do want to withdraw your question, just press the pound key. Thank you. I'd now like to turn the call over to Dr. Susan Hassmiller. You may go ahead.
Good morning, everyone. This is Sue. It's nice to have you online this morning. And I'm really excited about this webinar that we are putting on for you. It really marks the beginning of a process that we are going to begin at Robert Wood Johnson Foundation to produce another report. So, of course, everyone remembers the report that came out in 2010 and then our wonderful campaign with the vision at Robert Wood Johnson Foundation to really build a culture of health and equity in this country. We are very fortunate that the foundation is supporting, once again, another report. We're calling it the Future of the Future of Nursing 2030 report. And I will be going down there the same way I did for the first report and helping to lead that effort. This report will really have everything to do with the nurse's role in building a culture of health and equity. And as I was at the New York Action Coalition several months ago, many months ago now, talking on leadership and lots of different things, the campaign, I really mentioned at that time that we were going to Washington, D.C. to do another report, and said at that time that I really wanted to have some focus groups. And I did formally with the first report, and it was really going around the country, and I remember asking people their opinions and having them fill out postcards. So it was very informal. This time around, we really wanted to formalize that process. So we are doing a number of focus groups around the country, specialty groups, school nurses, public health nurses, frontline nurses. I was just in Nebraska and facilitated their focus group. I just did one for United Healthcare. I am only personally facilitating 2. We have our communications team that's really taking the lead in doing focus groups around the country. So getting back to New York, when I was doing a presentation there several months ago and really outlining all of the groups that we were going to hold listening sessions for or focus groups, it was really the New York Action Coalition that said, can't we do one? We really wanted to do our own focus group. And I said, that sounds like a great idea to me. So we put together a guide that everyone can use, and I'm not going to get into all those details. Our communications team will be going over that. But we're really excited and very hopeful that a number of action coalitions will do their own listening sessions. Everyone will have the same guide, so that in the end, we're going to bring together all of these answers from the action coalitions, from all of the specialty groups. We're going to do AARP. We're going to do some, hopefully, some CEOs. So we're going to bring all those answers into one report and, call it something like Voices from the Field, and turn that over to the National Academy of Medicine Committee this winter, and that will be one of many, many documents and reports and research that the committee will look at as they undergo their discussion around the nurse's role in building a culture of health and equity, and they make their recommendations. So with that introduction, I think I will, I'm going to stick around on the webinar, and I will answer your questions. I will let you know how the Nebraska one went, and I did one for United, so I'll answer some questions, but why don't we get right to the how of this, how you can help.
Great. Thank you very much, Sue. Hi, everyone. Good morning. This is Mary Boyle, and I'm the Director of Communications for the Center to Champion Nursing in America. And I'm pleased to be here with my colleagues on the communications team, Meredith Corville and Aidan McCallion, as well as many of our extended CCNA team who are in the room. So thank you so much for joining us. Two really quick housekeeping things. We'd like everyone to know this webinar will be recorded and it will be available on the campaign's website at campaignforaction.org. And if you do have questions, the operator mentioned, punching *1 if you have questions. You can also send in questions through the chat feature and we will answer them at the end of this call. So and I also want to mention we are joined by McCabe Messaging Partners, which is a firm that supports RWJF and supports the Campaign for Action. Also, we have Becky Watt-Knight and Danielle Robio. And this is important because Bethany, unfortunately, can't be with us today, but she is going to remain a contact on this project and a name that a person that you might be emailing at some point. So we just wanted to point that out. So let's just jump right in. We wanted to give you some things to think about as you begin to plan for a listening session. We wanted to give you some, guidance on timelines and how many people and those kind of things. So let's just jump right in. MMP, the firm I just mentioned, and Sue have done a number of these and suggest that these not go over 90 minutes. 75 to 90 is ideal. It's a big chunk of time to ask from people, and we think it's important that you stay within that time parameter. You also, of course, you want to, you're going to think about your invitees and that 8 to 10 people are ideal for this session. You don't want it too large or you won't get to everyone in the course of this listening session. And so we'll talk a little more about who should be invited, but once you get that group together, I think it's important to kind of consider who will be in the room and try to find a day or a time that is, convenient for your audience. Is this going to be more convenient in the evening? Is this going to be more convenient in the early morning? Obviously with the goal of maximizing participation in this event. It's also important to choose a location with plenty of space. If you don't have access to a conference room, something like a public library could work well. If, we're happy to brainstorm with you if you really have no ideas, but we were thinking probably this group would have access to space, but a public library works well. Next slide, please. So who should participate? As Sue said, RWJF is looking for, a lot of different voices here and looking for nurses as well as non-nurses. Now, nurses is pretty clear cut. So what are you looking for in a non-nurse? And, it's community leaders who have a working knowledge of healthcare. You want to bring people to the table who will be able to contribute to a conversation about, what is going on now with healthcare and where are the gaps and what nurses can bring to them. So in our thinking, it does require some kind of base knowledge as opposed to kind of just reaching out to, for example, a random elected official or something. As we talked about, 8 to 10 people, as well as inviting people about 3 weeks in advance. We have created a template that we will send you to invite people, an email template, so you can just put in names and email addresses and send that out. You'll obviously have to personalize it and put in the location of your event, but we're trying to provide as much as we can to make this easier. Couple things to remember when recruiting for people. Again, we are looking for those who have insights to share on how the nursing profession should evolve over the next 5 to 10 years. People who can talk about the biggest challenges facing the profession and the biggest areas of opportunity for the nursing profession. In your recruitment efforts, we hope that you can find a cross-section of nurses, frontline nurses, nurse leaders, as well as representatives from public health, academia, non-traditional settings, again, with some working knowledge of the healthcare system. Also, we hope you will aim for diversity. Please include male nurses and as well as nurses of color and nurses of all ages, as well as people of all ages. Next slide. We suggest that you appoint, perhaps you are the conversation leader / moderator, and that you identify someone in your group who can take notes for this. We're also going to ask that you record the session, and the notes should be sent in along with the transcript, and we can walk you through this when we get there, to MMP. Now, what do you say at this session? The good news is that we have a guide that really walks you through every step of the way, and we can send that to you. It covers what you should cover and gives you suggestions for how you are going to present it. And we're going to get into a little more detail on that next. So I'm going to hand this over to Meredith Corville now, who's going to talk about in more detail about this guide.
All right. Good morning, everyone. This is Meredith. I'm actually going to walk you through some of our kind of tips for holding one of these listening sessions. So we've got 10 of them for you. So to kick it off, the first thing that we recommend that you do is to practice ahead of time. So this would involve familiarizing yourself with the discussion guide and reading it aloud a few times to just sort of walk yourself through the questions, to familiarize yourself with what's in the guide so you feel really comfortable facilitating and that you feel prepared before you go into your session. Our next tip is to prepare. And so this is doing things like maybe preparing some name badges for all of your participants that have everyone's first name listed. And so that will make your job easier as the note taker and the facilitator, and it will also make it more comfortable for the participants so they know who is speaking. We also recommend that you bring a timer to help as you're facilitating to keep your discussion on track and on time. And then also preparing would involve doing things like having a pitcher of water and cups for participants in case anyone needs refreshments. And then our third tip is to make sure that everyone feels very welcome. And so it can be a bit intimidating to come into an environment where your attendees may or may not know others. So just as they arrive, make sure that you give them a personal greeting, help them, point out where restrooms are, just help everyone to feel comfortable when they show up. Let's move to our next slide. So our fourth tip is around laying some ground rules for the conversation, and this is really critical to ensure that folks really can feel comfortable being open and candid in the conversation so that you can get the best insights that you need. So at the very beginning, we recommend that you explain that what people are sharing in the room really should remain in the room, and that's a really important thing to mention. It's also important to let folks know that they are there as individuals, that they're not there representing the voice or perspective of their employer, and that the room should really be a safe space for them to speak freely and openly with one another to best inform this document. It's important to also let folks know that the comments will not be attributed to them or to their employer. So just laying all of that out there for folks at the very outset of the conversation will really cover a lot of ground into helping people feel comfortable. Along that line, in the spirit of transparency, though, it is important to let participants know that you will be recording the audio of your session. And so this is something that you can do relatively easily. If you or anyone that you're working with to set up the session has access to an iPhone, there is a standard device that you can record a voice memo on that you can use to do this. And I can answer more specifics during Q&A, but we encourage you to record your sessions as well as having a note taker to really ensure that you are capturing everything, because even the fastest writer and typer will not be able to capture everyone's comments. So the recording will really help to facilitate that. We also recommend that you stay on time and that you start on time as well and end on time. And that can be a challenge with, as much ground as you will have to cover. But the discussion guide is really set up to help you to do this. Once you see it, what you'll notice is that it has suggested amounts of time to spend on each section. And it will be important to explain up front to your group that, you may have to keep things moving. Everyone may not be able to respond to every question to ensure that you get through all the topics, but that it's important to stay on time. And using a timer, again, can help you to do that. And then the sixth tip is don't diverge. So this is really a tip for your facilitator. It's going to be very important that you stick firmly to that discussion guide, because in order to really compare all of the answers fairly and across the board, all of these different groups need to be asked the same questions. So again, that's why we really encourage everyone to get through the guide so that we can really compare everyone equally. And now I'm going to turn things over to Aiden, who's going to continue with our tips.
Thank you, Meredith. Hi, everyone. So tip number 7 would be keep a poker face. As the moderator, you don't want to make any comments that might influence a participant's responses. Avoid affirming or disputing an answer, including making subjective comments like, that's interesting. If you feel like you must respond, use neutral phrases like, okay, got it, or tell me more. Tip number 8. Avoid giving your opinion. If someone asks you your opinion on a specific point, whether it's for more background or to affirm an opinion, avoid the urge to respond. Try responding with, I'm not an expert on this topic, so I can't answer, but I'd like to hear what the group thinks about that. Next slide. Tip number 9, be straightforward. Repeat a question when needed, but avoid offering additional clarifications or insight. The guide, which you will request from McCabe, is straightforward, and you will want to make sure that you have the participant interpretation of the question to help them and the participants inform their own answers. Tip number 10, make sure everyone speaks up. Don't let one person dominate the discussion, no matter how talkative they might be. In the beginning of the session, you can even say that all participants, you want to hear from all participants, and so if you don't hear from a certain participant, you may call on them. Next slide. So those were the 10 tips. We're going to be moving into what you will do after the session is over. Well, immediately after the 75 to 90 minutes, of course, you want to thank all the participants for their times and contributions, and then let them know what's going to happen next. So what you will be doing, like sending this information on to McCabe, and how this will be put into a report possibly for the National Academies of Medicine. You also want to make sure that you keep the participants engaged. If they're not following the Campaign for Action on our Facebook or on Twitter, you can invite them to friend us, or you can have them also sign up for the campaign update. You also want to make sure the participants are connected with your action coalition after the session as well. So if they're not already, make sure, if you have a newsletter, you have the link for them to sign up, or if you can collect the name and everything so that they would receive email, or if they have, if you have any social accounts and everything, please share with them. After the event, probably within 48 hours, you would want to start creating thank you notes to send to the participants. Again, just saying how much you appreciate them coming and being able to share what they were thinking on this topic. Once you gather everything with your notes and the audio recording, please then send them on to Danielle, and her email address is on the slide. I'm going to turn it over to Mary now.
So thank you both. I just want to underscore one thing that Meredith said, which is, this guide was written, everyone should be answering the same questions, and that it really is very important to stick to the guide. And while you may, conversations obviously can kind of veer many different ways, a main message here is do your best to stick to that guide. So when we are compiling all this feedback and all the input we are getting, there'll be common denominators and common threads that will make it easier to relay this information. So you've heard some kind of high-level tips, and you are thinking you would like to do this. Obviously, it's a fairly tight timetable, and that Sue is looking to get these completed by December. So the first step, and really the only step that you would have to do, is email Bethany and Danielle, whose emails and phone numbers you see on this screen, and ask them for the invite template as well as the guide, and they will send them to you, and then you can be off to the races to pull together your group. And we are here to, support any needs that you have as you start going down that path. And I'm sure it'd be really helpful to hear from Sue before we go into Q&A a little bit about what the Nebraska listening session was like. So, Sue, we'd love to hear about that.
Okay. So here's the one thing I would say. These tips that you all outlined for these focus groups or listening sessions are really right on, I will tell you. Nebraska, we don't have Victoria Vinton. We don't have anybody from Nebraska on the phone. Is that correct?
No, I don't believe we do.
Okay, I just wanted to make sure. Yeah, so it was very interesting, and one of the things that happened to me was I did diverge, and it's very, very easy to diverge because we're all interested in this topic, and the conversation just gets going, and before you know it, 75 minutes turns into 80, 85 to 90, and then beyond. So that did happen in Nebraska. I would really, really recommend sticking to the guide as much as possible. Having done this twice now, I picked up on a few changes or little glitches in the guide, and I think there's one more small iteration that the guide should have before we send it to you. But I think that it's all in all a really good guide. It's repetitive in some ways, but in a focus group and a listening session, you do want some repetition because that's when you pick up themes. So I'm okay with that, but you don't want to be so repetitive that people are saying, well, I just answered you, But with these changes that we'll make in the guide, I think we'll catch some of that repetitiveness. It's really important to thank people. They've taken time out of their day. People were excited. And I think Victoria will tell you this too. The people in Nebraska and my colleagues at United Health just felt like, oh my gosh, I'm having a voice. Obviously, not everybody gets to be on this committee. It's really, really hard. We'll probably only have about 15 to 18 people on the committee and from multiple sectors. And it's, for the most part, a closed-door process. We will have some town hall meetings, some site visits, but for the most part, it's a closed session. So Nebraska and United were very excited. I think if they were here, they would tell you that they had a voice. They felt like they had a voice in this process. And I believe, that's what the folks in your states would say as well. I've mentioned this idea to other action coalitions that I've been at, and I don't know if they're represented on this phone, but I will tell you that just unanimously, people were very excited about the possibility of having a voice in this process. So I hope you really do move forward with doing it. I just sent the team a note. I think we should activate some of our, or all of our public health nurse leaders and breakthrough nurse leaders to help with these sessions with the Action Coalition lead. So I'd love to see that partnership. I want to send a note to them, today, tomorrow, to let them know that this is going on, to contact their Action Co-lead so that we can really get some activation around this. So let me stop there and say great job on the tips. They're completely right on, and I did not have those tips myself going into it, and they're just perfect. So why don't we see what questions there are? How many people are on the line?
I'm checking.
Yeah, and I would like to know, I'd like to know who's really going to move forward with this. If you're online, maybe you have a listening session already scheduled. Let me know what kind of plans you have so far, if any of you are that far, or maybe you were waiting for this webinar.
We have about 15 Action Coalitions on the phone, or 15 people on the phone.
Okay. So I can't see where messages or questions come through. You got a couple of questions? Okay. And there's only 15 people. We might want to open the lines, too.
Yeah.
Adam, could you see if there are any questions in the queue?
Yes, I can. And we actually have closer to 30 at this point, too. So I'll just remind everybody at this time, if you do want to ask a question over the phone, just press star, then the number 1 on your telephone keypad. And again, if you do want to withdraw your question, just press the pound key. So we'll pause for just a moment to compile the Q&A roster.
Nina sent a message through the WebEx chat, and she asked about if there'll be if you can get access to the slides. They will be posted on the website along with the webinar recording, and that should be available within 5 business days. Within about 5 days.
Okay. That's great.
And we do have a question over the phone from Cynthia Bynamy. Cynthia, your line's open.
Good morning. Good morning, everyone. I'm from the Louisiana Action Coalition, and hello, Sue. How are you doing?
Hi there. You're infamous. We know where you're from, Cynthia.
But this is very exciting. And as I was listening, your mind immediately goes to, well, we have this leadership team, this core leadership team that it has representation from many of these entities, but I could see where that can expand. What I'm thinking is that when we say 8 to 10 people, it seems like you can immediately think of at least 15 to 20 people. So can this be too large, or what are the thoughts related to that? Because I think 8 to 10 to really get a good cross-section of nursing and non-nursing leadership within the state, I think would be very limiting, but I don't know.
Yeah, I see where that is a huge dilemma. I really do. The only issue is, Cynthia, and you know it too because you're a well-experienced leader, you get 15 to 20 people in a group, and they don't all have a voice. You know, there's just not time for them to have a voice. So I don't know if you would be willing, and I'm certainly open to this, completely open to this, if you wanted to run 2 focus groups. You know, my only, so that's entirely up to you. I mean, what are you thinking?
I part of me, I guess a good part of me is thinking about the time factor. And, running 2 groups. But,
you know, Cynthia, this is Mary Boyle. I mean, it's, you know, maybe you do start with a group of 15 or 20 invitees, and by the time, you know, you have winnowed out people who can't come at the day and time that you were going to have it, you know, maybe it would be a little smaller. So I do think, you know, you have to operate on the assumption that probably everyone you invite is not going to be able to make it. So I don't think it's a bad idea to be thinking broader than 8 to 10.
Oh, well, thank you. Thank you. That's very helpful.
Yeah. Good luck as you move forward.
Thank you.
And we don't have any further questions on the phone at this time, so I'll turn the call back over to the presenters.
Sue, you know, one thing, this is Mary, that I was thinking might be helpful. Did you get a sense of who was in the audience, who Nebraska invited? Not the audience, but who participated in their listening session?
Yeah, it was really their Action Coalition. And so there were probably around 8 nurses and then 2, nurse champions. So one of them was their partner, I think from the Get Well Network. It's a 501c3, and then another consumer kind of person. So it was, I'll be honest, it was really, really helpful to have a couple of perspectives. I know you want to invite your usual, Action Coalition folks, but it was really interesting to have people who were not nurses to sort of play off the answers and bounce ideas off of others. It was really interesting. And then at United, it was a very, multidisciplinary group because it's a board that I co-chair, and we had a couple of physicians, social worker, pharmacists, and then mostly nurses, but then sprinkled with other kinds of people.
Great. So
I would definitely recommend trying to, mix it up a little bit if you possibly can.
And, since we have an extra minute, I think it'd be great if Meredith talked a little bit about recording this event, because this is important too. We didn't really get into some of the details there.
Sure. So as we mentioned, you're going to want to capture your session in 2 ways. The first way is as having that designated person to be your scribe, that's your note taker, and that's an important role. But in addition, we are strongly urging everyone to record your session, and this is really so that you can make sure that nothing gets missed. And even the best note taker will not be able to capture everything. And the great news is that with our smartphones these days, that makes it very, very easy. So if anyone has an iPhone, and I'm sure other smartphones as well, there is a voice recorder on it. You can record audio very easily. I would encourage you to practice first, but it's pretty much you just hit a button and you just put it on the table and you let it go. And the microphone is rather sensitive, so it should be able to capture all of the comments, assuming you're sitting around a large conference table and are not, in a larger space. And then when you submit your notes to Danielle, we encourage you to also strongly encourage you to attach the audio recording, and that you can email that typically from a phone to yourself or to someone else. So it should be relatively easy to do if you have a smartphone. But again, if anyone has specific questions about that, we would be happy to help you with that or answer any questions. But again, that's just really going to make sure that we have everything and all of the content, and then we will be transcribing that so that all of your participants' remarks will really be captured, and that is just really important to make sure we're getting all of these different voices. So again, if you have questions, please follow up, but we'd be happy to answer those.
And we'll put, I hope all of you received the campaign update that goes out every Tuesday at 5 p.m. Eastern Time. We'll put a blurb. We have another edition coming out Tuesday. We'll put the addresses of the McCabe message partners who are joining us on the phone today. Those are the people you reach out to get the invitation template as well as to get the guide. So, are there any other comments or questions?
And as a reminder, you can also type in your question too. If you don't feel comfortable asking it on the phone, you can send it to us privately and we can answer for everyone.
And I'll just remind people at this time, if you do want to ask a question or if you have a comment, just press *1 on your telephone keypad.
So we have a question with regards to the timing, and the goal, I believe, is to have these completed by December. That's right.
I think they could go to the end of December at the latest, but yes, we're looking at the fall of 2018 to organize and conduct and submit all the materials.
Thank you.
And we do have Coletta Barrett queued up on the phone. So, Coletta, your line's open.
Good morning. Thank you so much for this presentation. One of the things that we may want to consider, not just in Louisiana, but as we make these requests out across the country, in many areas, multiple partners have come together around community health needs assessments and developing community health implementation plans. And so reaching out and connecting with those already multi-sector groups working in that space may be a really good way to get that broad sector approach that's already looking at community health and then asking the questions about, so where's the role of nursing and how does that look? So that just may be a structural approach to look at how we might go about getting additional input.
That's an excellent suggestion.
Thank you, Coletta. Thank you.
Yeah. So let me just, a couple good questions have come in. Someone's asked, do these sessions have to be in person? And I think it's highly, highly, highly preferable that they are. I think it would be an entirely different dynamic if this was done on the phone. And really, as Sue said, there is a kind of a consistency and a repetitiveness throughout this guide that you will see and through this conversation, because you are trying all of these sessions that are being held across the country. You want to come out of it with a similar, you want everyone talking about the same thing, basically. I think you'd have a lot less control over the phone, so the in-person is highly preferable. And I think we may have had a couple of people come in late and are trying to figure out, why are we doing this? And again, Sue said at the beginning, this is to support the Robert Wood Johnson Foundation as it sets off on a new report with the National Academies of Medicine. This one's going to be different than the Future of Nursing report. It's going to be on the health and well-being of the nation and what the healthcare profession, as well as nurses, can do to basically improve America's health. And so this is obviously going to be very nurse-oriented. We're trying to get feedback from you and your colleagues and your community about what nurses, where are the gaps in the healthcare system in terms of what nurses could be doing to be leading more in health and wellness in our country. And so for the person who asked this, you've heard these sessions will be recorded. All of them will be kind of pulled together in a report that has top lines from the different listening sessions, and that will make its way to the National Academies of Medicine and inform that report. Thinking about some of the members from our Action Coalition with some key invitees, does that sound like a good mix of participants? I mean, I think that we are. Thank you for that question. I think we are looking, ideally, to expand beyond the Action Coalition. I mean, I'm sure your Action Coalition is going to be the heart and soul of this, but if there is any way that you can broaden it, that you can include community leaders who are knowledgeable about, about health and kind of what is going on out in the community, that is ideal.
Yeah, and I would just add to that, Mary. I think ensuring that there are diverse voices that are represented in your session. So making sure that you have nurses from different cultural backgrounds, nurses of color, that you include men, that you have frontline nurses, nurses who are in nursing faculty. Just making sure that your group really is a diverse reflection, not just of nursing, but also of your community. And so I think for most that may mean that you step outside of the Action Coalition. And I also think it will probably lend itself better if you are bringing together a group of folks that maybe don't have any familiarity with one another. And I think sometimes when you're bringing together maybe a group of insiders and then you maybe have a few others, that might not lend itself to the most even dynamic in terms of facilitating a discussion. And so I would just encourage folks to, I think, obviously if, you have a difficulty getting a group together, you have your Action Coalition members. But I would encourage you to think outside of that tent to the extent that you're able to.
So let me add on to that too. So I agree with everything that Mary and Meredith just said, but I don't want the perfect to be the enemy of the good. And what I mean by that is you're sitting here thinking, oh my gosh, how will I get this X, Y, and Z? Your schedule, your own schedule is so limited. Your time is limited. If you have time to bring your Action Coalition together and maybe get one or two additional people who are maybe already part of your Action Coalition, that's good. I would say because of the limited time, I don't want to dissuade you because you're thinking, I can't possibly now go out and get all these other people. No, so do what you can in the time that you can, and if you can get a few extra people, that's great. If you can't because of time, I would prefer getting results from an Action Coalition versus no results because you just didn't feel like you could have time to reach out.
When? No, okay. Thank you, Sue.
Adam, are there any other questions in the queue?
Yes.
No, we have nobody else on the phones.
I do have another question I'd like to bring to Sue. Could you target doctoral nursing students to come to the meeting?
Sure. This is really, we're giving you this opportunity. We're going to hear from a lot of people around the country through town hall meetings, through people's research. So we're going to have a lot of vehicles to bring voices together. We have given you a webinar, we've given you some guidance, and now it's really completely up to you with how you proceed. And sure, it would be great to have a couple of doctoral nursing students, of course. I had, in Nebraska, there was one doctoral nursing student, and she was, she added a lot to the equation because she could really answer. She was actually a BS and a PhD student, and there's a couple of questions about nursing education, and she could really answer them from a student perspective very, very well. So I was glad to have her in the focus group.
That's great. Thank you. All right. Well, if there are no more questions, I think we're all set. Thank you, everyone. Feel free to reach out to me or anyone on the communications team if you, need some support, guidance, anything that we can help you with.
And this concludes today's conference call. You may now disconnect.